So you've probably heard the term neurodivergent on social media, but what does that exactly mean? And how do you know if the information you're seeing is accurate? Hi, I'm Michelle Young, licensed clinical social worker with Mental.Health.Merienda.
And I'm Dr. Adeline Leon, licensed clinical psychologist. So neurodivergent, it's a term used to describe individuals whose brains function differently from what's considered to be typical. It's a non-medical term, but it includes conditions like autism, ADHD, and dyslexia. It's gained a lot of popularity because it offers a non-pathologizing way to describe these differences. And so it emphasizes that people are different, they think differently, their brains function differently, instead of saying that they're disordered.
Yeah, it's a way to highlight that people have different strengths and challenges. And we're really seeing this explode in popularity, especially on platforms like TikTok and Instagram. So people are using these mediums to share their experiences, create communities, and just raise awareness about neurodivergence. So Adeline, so why do you think this term has resonated so strongly on social media?
I think it's a few things. I think that social media, it does really well with relatable content, personal stories. TikTok, especially, I think the TikTok platform does really well with that. And the neurodivergent narrative, it allows people to share their experiences. It might have been something that before felt really isolating because, like we said earlier, it's a not neurodivergent, it's non-pathologizing. You don't feel like, oh, there's something wrong with me. You feel like I'm different, and this other person is sharing their story, and they're different just like I am. So it can create that sense of belonging for people. The only thing is that there's the downside of that. All of that is great. But the downside is that it could also lead to people self-diagnosing themselves based on content that's really relatable. Like, oh, I'm like that too, so maybe I also have autism.
Yeah. And we have to also make that distinction, like neurodivergent, we said it's non-medical, it's not a diagnosis versus something like autism or ADHD. That's an actual diagnosis. So sometimes maybe they get conflated, but like you're right. So again, there's a lot of pros and cons. That increased awareness, that building a community online with different people who are like-minded like you, all of those things are positive. But there's that concern that people now are questioning if they have autism, or maybe they're neurodivergent, or maybe they have ADHD. And it's coming from these like broad, oversimplified descriptions of different traits, neurodivergent type traits that are on social media. So that obviously has a lot of risk. And we've said time and time and again, like self-diagnosis is a big no-no. Do not do that. Do not do that based on what you see on TikTok or on Instagram. So again, there's a lot of risks. The main thing being misdiagnosis. So even like for us, we can't like just self-diagnose ourselves. We would still go to another mental health professional to diagnose. Not to mention diagnoses like autism, like ADHD. They're all very complex conditions that require a comprehensive assessment by someone who is, and we've said this before, licensed mental health professional. And even though social media could be, really insightful, really inspiring in some ways, but it's really hard to capture the complexity of a diagnosis in like a 1-minute clip or in a 2-minute like little video.
It's impossible to do that. Like so many nuances that you just don't have time to get at that in just a 1 or 2 minute clip. There's no way.
Definitely.
So I've seen many patients in my neuropsychology practice who can identify with certain autistic traits and assume they have autism, which is what brings them in to come in to see me. But then when I go through, the test results and I explain that they don't have autism, sometimes they can be really shocked and frankly, even a little upset, because if you go into a situation thinking that, oh, I definitely have this, I know I have this, I'm going to see this neuropsychologist basically to, put the stamp
Confirm.
of approval and confirm what I already know, then it could be a little even like, discouraging or disheartening to find that that's not what you have, because the person's coming in because they're struggling. And so it's nice to have a name to put to what you're struggling with, and to have, like we said earlier, that sense of belonging and community, and like, oh, I have autism like these people do on, that I've seen on TikTok. And let me just go see a neuropsychologist to confirm that. But what can happen is that some of the traits, and that's what's wrong with self-diagnosing based on TikTok, where TikTok might say, these are some of the traits, if you have these traits, you might have autism. But, you can have trouble with maintaining eye contact and, social interactions. And it doesn't necessarily mean you have autism. Maybe you have social anxiety, or maybe you're just introverted. which is perfectly
right?
fine. Yeah, I
Yeah,
mean, I'm
and you have no
introverted.
diagnosis.
You're
That's not
introverted.
clinical.
Yeah,
Yeah,
yeah. We don't have
yeah.
autism, and it's completely fine. So it's that you can have so many traits in common with autism and so many other mental health conditions, and they're not necessarily due to that condition. They can be due to so many other things. So that's why, like Michelle, like what you mentioned, that holistic assessment by a mental health professional. That's what we do, and so that's why that's so important to make sure you do that.
Yeah. I mean, as clinicians, you and me both, when we diagnose, we don't just look at a list of symptoms. We look at the person, they come in and they tell us their history, their story, and then we look at all that plus their symptoms in a holistic way, the whole person. So diagnosing is just much more than like, okay, let me just check off, like, do you have these traits? Again, while social media can be informative, this trend of oversimplifying these descriptions and these traits of diagnoses and then seeing this and then self-diagnosing, it could be really trivializing, especially to people who actually do have those diagnoses. So someone who is in fact autistic, and then now people are kind of claiming like, oh, me too, because I feel kind of awkward in social situations. It's trivializing the whole experience of someone who has that diagnosis. And that goes for, any of the neurodivergent diagnoses.
But Michelle, what do you think are some ways that we can address this issue?
Yeah, so I think one key thing is just education, right? So again, and I think that's what people are starting to do. So it's really great to learn about neurodivergence and the different diagnoses that kind of fall under that umbrella. It's great to explore and to learn more about them. But then while self-reflection is very valuable, if you really do think that you might be like, oh wow, I feel like this might really is something I'm experiencing, or this might fit, into my, what's going on in my life, then you really want to make sure to get that proper diagnosis. So again, go and see a professional, a licensed mental health professional who can give you that assessment. And we definitely encourage people to seek any professional help, really, if they have genuine concerns. Again, rather than solely relying on social media to give you the answers. You want to, if it's going to foster that exploratory, that curiosity, that's great. But then you want to take it another step. And if you do think you have those concerns, go ahead and seek that assessment.
Yeah, definitely agree. And we'd also advocate for being mindful of where you're getting information from. So there are mental health professionals creating mental health content like us. Information from, again, an actual licensed mental health professional should be taken more seriously than a creator who has no education or training in mental health.
Yeah, so actually, there was some recent research that was published in the Journal of Autism and Developmental Disorders, and they examined kind of like what's going on in social media. So they examined engagement indicators, so number of views, number of likes on TikTok videos with the autism hashtag. So there's actually research on this.
And the researchers found that TikTok can bias understanding about autism in two ways. First, by providing just blatant misinformation, just completely inaccurate information, like claiming that a certain product can cure autism, and then they're trying to sell that product, which is not
That's
accurate.
awful and unethical.
Yeah,
Just totally
I know.
unethical.
Yeah.
Yeah.
Yeah, but again, if you're not a licensed mental health professional, you're not bound by any kind of ethical standards, so you can really
True. Yeah.
do whatever
Say
you
whatever.
want. Actually.
Say
Yeah,
whatever.
that's the problem with it. Yeah. Secondly, by overgeneralizing an individual experience to the entire autism spectrum and not representing the entire spectrum of manifestations within the autistic population. So again, it's autism spectrum disorder. It's a spectrum, which means that different people, you can have two people with autism who present completely differently. One who's very verbal and has a very IQ, one who has a lower IQ and is not very verbal, one who has more sensory processing issues, one who has more social, more issues with social engagement. And so no person presents the same exact way.
Yeah, that's so true. And I think too, it's also important to remember that when it comes to social media, it's very curated, right? It's again, like it's oversimplifying these complex diagnoses. So I think we also have to remember that as people, like for ourselves, we have to also remember that, our individual experiences are unique and complex. So we don't want to sell ourselves short by trying to fit into this label, to fit into this box, again, based on like the little bits of information we're seeing on social media.
So, what we're trying to say here is that while social media has opened up important conversations about neurodiversity, it's important to avoid self diagnosis and seek professional guidance if you question whether you may have a neurodivergent condition like ADHD or autism. But if you want more information like this, tune into our videos to find out more about neurodivergent conditions as well as other mental health conditions. And thanks for watching.
All right. Thanks. Bye.
Bye.